advocate those tests for anybody as a
Okay.
screening maneuver. It may be useful as a diagnostic test in the same way, say, that if you have a mass in your stomach, say, you might get a CAT scan of your abdomen at an X-ray exposure of about 100 chest X-rays, but there may be justification because you might have cancer, say, in the liver.
Yeah.
But that's a entirely different test. You and I, for screening purposes, want a safe, low radiation test, and that is a heart scan.
Okay,
Now,
and you see and just to be clear, in the future you see more machines coming out that will address that and do the scan with lower radiation, basically.
yes, I think
Okay.
that's true. It's been brought to the forefront, and the engineers are a clever bunch. They're going so fast and developing new technologies in this area that I think we're bound to see reductions. Or perhaps there'll be a new technology altogether that provides a similar function without radiation. That'd be even better. But to my knowledge, there's no such thing in 2008,
Okay.
and not on the near-term horizon. Now, in answer to the question, what do you do when you're not at that age 40? There are people where we do advocate younger. So, for instance, if there's lots of heart disease and very young people in your family, say your dad had a heart attack at 38, you might consider a few years earlier, say age 30. But the question was someone in their 20s, and I think one of the reasons for not advocating heart scans at that young age is the overwhelming likelihood is that the score is 0.
Ah.
And so you'll get a scan for no benefit whatsoever. And so I think you're left with the second best, and that is to use blood work to identify risk. And I don't, by blood work, of course, I don't mean cholesterol values, because cholesterol values to me are a relic of the past. We need to
Sure,
do
okay.
away with conventional cholesterol panels because they are so fraught with misinformation that they provide such damning levels of misinformation
Yeah, well,
that I
You know,
Mhm.
one thing that it just popped into my head. I remember getting a cholesterol screen in high school. They just started doing this one year. They were going to do cholesterol screening, and I lived on a dairy farm, so I ate ice cream and butter and things like that, and I drank a lot of whole unprocessed milk. I mean, it's straight from the cow, and so my HDL or LDL, it was high. It was like 180, 190, something like that. But I'm a fairly lean guy, and I thought I was perfectly healthy, you know. And I played basketball, I was in sports, but there was a stigma all of a sudden because I had a slightly elevated HDL or LDL. I can't remember exactly what it was, but the number was 180 or 190, and it was above what it should be for someone my age. Apparently, is what they were saying. And they asked me. This is the funniest thing. The nurse who took the test said, "Do you eat dairy products?" and I mean, I grew up in a farming community. I mean, it was based on dairy farming. And then she asked, "Do you eat eggs?" And I'm like, "Yeah, I eat eggs," and all this stuff. And she was about to recommend, or she basically said, quit drinking this raw, unprocessed milk and stop eating, eggs, and you gotta no fat, and all this stuff. And well, I didn't really listen to her. I don't know if it's because I was a kid, or maybe I knew some in the back of my mind. Maybe I knew that it maybe wasn't the best advice. I don't know.
Well, you've made an excellent point, and that is one of the reasons I advocate entirely doing away with total cholesterol values.
Yeah.
Is that there's numerous levels of misinformation provided by that value. For instance, what if someone had a very high HDL cholesterol? That's a good thing. Yet it elevates the total cholesterol value. And so you can see how that can muck up the value of that total cholesterol. What if they had a high HDL? That's good. And a low LDL? That's great. It's going to affect, because the total cholesterol is the sum of LDL plus HDL plus triglycerides divided by 5.
Okay.
And so in reality, the LDL value, the one number that has been the source, that is the foundation of a $27 billion a year industry, is a calculated value based on a very flawed equation. So what I tell my patients is LDL is calculated, but I truly say it's fabricated because it's subject to such enormous inaccuracy. And that's why I advocate measures of a different sort that provide a whole different level of confidence, far greater than standard cholesterol values.
Okay. All right, and I just want to get to another audience question here. And seeing as that we're approaching the 1 hour mark, I'm not going to keep you going here too much longer. But I just want to let everyone know that we'll be wrapping it up here in a few minutes anyway. I want to say, if you got any last questions, please ask them. And I see someone did ask a question about what has your experience been with the regression of coronary plaque, and I take it that that is a personal question, as you mentioned earlier, that you followed Dr. Ornish's advice and you ended up with more plaque and more diabetes risk, or I can't remember exactly yet, but how is your, how quickly did you turn around your heart score?
It took me about 2 years. Now, I wonder if the question asker is really asking about what kind of success rate do we have in the program. Now, our data is coming out for publication. It should be coming out anytime now. It'll be coming out in the American Journal of Therapeutics. It is our retrospective, that is our kind of collected data over the last 2 years. By the way, we have experience with a far greater number of people, but what I saw 2 years ago was an enormous leap in success in reversal of coronary plaque as judged by heart scan scores. In other words, we were having success up till 2 or 3 years ago, but then I saw an enormous jump where I used to be happy. I used to be thrilled with getting 3, 4, 8% reduction in heart scan scores. I started seeing 18%, 24%, 36%, 51%, 64%, enormous unprecedented levels of reversal of heart scan scores.
Wow.
And I credit that to the addition of vitamin D.
Wow,
D
okay.
has changed, and there's no turning back, Justin, with the vitamin D conversation. And I'm grateful that the media has made an issue of this, because it's made my life a lot easier.
Yeah, no kidding. And someone did mention a question that reminds me, a question did pop up just a couple minutes back about vitamin D, and about where do you get most of your vitamin D if you're not going to be able to get it from the sun, which isn't particularly reliable for everyone. But many things are fortified with vitamin D, like milk. And that's been a traditional source of vitamin D for many people. Other than, say, supplements, many people I know do buy the vitamin D3 supplement nowadays to take. But what other foods or areas can you get vitamin D from?
Well, first of all, vitamin D is not a vitamin, it's a hormone. So let me make that, it's called vitamin D, of course. But it is truly a hormone. It is a very potent hormone, and so with like any hormone, you and I want absolute precision how it's managed. And D is unique in that it's the only hormone that humans are meant to obtain from sun exposure. Now, this was true when we evolved at the equator, running naked in the woods or jungle.
Okay.
This wouldn't go over well in Wisconsin. So we need to get vitamin D from supplements. But now, by the way, there are other sources of D I do not advocate. For instance, there's about 100 units that's supposed to be in milk. Most of the time when the USDA has examined it, 70 units, it's often the ineffective form, which is D2, or uracilcalciferol. That is a form I think we should not take. That is, by the way, the prescription form. Expensive, and in my experience, wholly ineffective. And so the only form I advocate for D is D3, or cholecalciferol. That's C-H-O-L-E, calciferol. And you buy that in your health food store. It must be a gel cap, never a tablet.
Not a tablet.
Gel caps, yes. When you see repeated blood levels, you'll see that only the gel caps work.
Okay, yeah, and it brings me to another point here that I just wanted to mention, is that cholesterol as well is people don't understand exactly what it is, it seems, most general public anyway, because like I said, back in the 70s and 80s when they were trying to eradicate all fats from the diet, they linked, it seemed, nutritionists, dietitians, doctors, they linked cholesterol and fat as if they were the same thing. But cholesterol is also a hormone, correct?
It provides the substrate or the material for formation of hormones.
Oh, okay.
Yeah.
I wanted to understand that myself, because I know it was related anyway to hormones. Okay.
You know, Justin, cholesterol is enormously confusing. I don't think because it's intrinsically confusing, but because we've been, the understanding of cholesterol has gone through phases in evolution as well. And I think that we're approaching a time where the whole cholesterol lipid panel, the cholesterol panel,
Right.
has been such